Ayan. So, good morning everyone. Our topic for this week is the part 1 of DNA viruses. So, we're going to cover the parvoviruses, which is a small virus. Then the Poxvirus, yung mga malalaking virus naman. And also HPV or the human papillomavirus that causes cervical cancer. And of course, Polyomavirus. Now, first, let's talk about parvovirus. So, ang parvovirus class, ano ba ang target niya sa tao? So, sa tao, ang target nito is your precursor RBCs. Ibig sabihin noon, yung mga blast cells nyo inside your bone marrow. Now, ang parvovirus na yan, it can actually infect humans and also animals, di ba? Kaya nga naman, yung mga aso nagkakaroon sila ng parvovirus. However, kung ikaw ay tao, if you are a human, the one that will infect you is the Parvovirus B19. Again, take note na for the humans, the parvovirus that can cause infection in humans is Parvovirus B19. So what is the classification? It is under the family Parvoviridae. The genus is Erythrovirus. Bakit Erythrovirus? Kasi nga, ang target niya is the precursor RBC, your young erythrocytes. Yun ang kanyang target, yung mga batang erythrocytes. Okay? That's why the genus is Erythrovirus. And then the one that infects the humans is the Parvovirus B19. Now, it is very small. It came from the Latin word parvus meaning small. Kaya tinawag siyang parvovirus. Among the DNA virus, it is the smallest. So ano ba yung mga infection that this virus can cause? So it can actually infect the children, pwede rin ng adults, and also the pregnant women. Okay? So kapag children ang tinamaan, nakikita nyo sa picture, right? Meron ka dyan bata na pulang-pula ang kanyang pisngi. So ang tawag dyan is fifth disease or slapstick syndrome. So para doon siyang pinagsasampal sa muka. Hindi lang naman class sa face nakikita yung redness. Even on the trunk of the body and also sa limbs, sa mga kamay niya, sa kanyang arms, meron din mga redness, pamumula. And then when you expose the children sa sunlight kapag naglaro siya sa labas, then yung kanyang balat mamumula rin. So that is the characteristic of fifth disease or slapstick syndrome. Kapag naman sa adults, what will happen kapag adults? Magkakaroon siya ng aplastic anemia. Kasi nga, tinatarget yung red cells mo. The one in your bone marrow. Okay? And then, if the infection happen during pregnancy, anong mangyayari? Yung fetus, magkakaroon siya ng condition called hydrops fetalis, wherein yung mga young RBC ng fetus nasisira. So nakakaroon siya ng blood loss hanggang sa mamatay yung fetus. Okay? So that is the condition called hydrops fetalis. So how are you going to diagnose this? You can perform IgM and an IgG test, pwede, and also DNA PCR test for the parvovirus B19. So sabi dito, this is the pathogenesis of the infection. So sa mga bata, una muna, they're going to have rashes on the cheek. So mukha siyang slapstick appearance and then spread to the trunk and limbs, di ba? And then, the rash occurs more commonly in children as compared sa adults. It can also last as long as 2 weeks. And then kapag nga nainitan siya sa araw, pwedeng mag-trigger din ng rashes yon. Okay? So sa mga adult, it can cause a plastic anemia or plastic crisis. Pwede rin na arthralgia, arthritis, or both. Okay? So, it will happen sa mga adults. So, it can actually become more severe leading to pancytopenia. Okay? So, bababa talaga yung mga blood levels mo hanggang magkaroon ka ng congestive heart failure as a consequence of the infection. So, what is the sign that the patient is now starting to recover from the infection? So magkakaroon siya ng reticulocytosis. Ibig sabihin noon, yung kanyang bone marrow nag-bounce back na, gumagawa na uli ng mga RBCs. Kaya mataas ang reticulocytes. Okay? So that is what happened when the patient recovers. So sabi ko nga kayo, again, target niya yung young RBC, di ba? Kaya nga naman, it will replicate in the bone marrow. So again, do not forget sa mga bata, ang tawag ay slapstick syndrome or fifth disease. Sa mga pregnancy, during pregnancy, kapag na-infect yung fetus, the condition is called hydrops fetalis. Kapag sa adult naman, aplastic crisis or aplastic anemia, ang condition na nakita. So let's go to the human Bocavirus. This human Bocavirus is just a novel parvovirus. So, bago lang siya ng parvovirus. Ano lang naman yan, respiratory disease lang ang makikita mo dyan. Either sa upper respiratory tract na meron ka lang sipon or magkakaroon ka ng ubo, lower respiratory tract illness. Okay? So, that is what happens. And then, common siya sa Amerika kasi meron doong mga malalamig na lugar. So, common siya sa mga malalamig na lugar during the winter months. About 5 to 10% of children ranging from 7 to 18 months of age with upper and lower respiratory tract infection. And to detect this one, just perform the RT-PCR assay. So for the Parvovirus B19 paano ang diagnosis? Now, you can actually check for the IgM. Definitely, if you are IgM positive, then meron kang recent infection. So, if you are DNA positive naman, nag-test ka ng PCR, nakita mo positive ka sa DNA ng virus, you're going to correlate that with the IgM. If you are DNA positive and IgM positive, it means that meron kang recent infection. So, acute infection. However, if you are only DNA positive pero negative ka sa IgM, ibig sabihin nun meron kang chronic infection of parvovirus. So, ano naman itong sa fetus? Kapag sa fetus naman, ang tinitignan mo, ang kukunin mong sample should be the blood coming from the umbilical cord. Ang tawag doon ay cord blood. And then you're going to collect that by performing chordocentesis. So, ganun pa rin, dalawang test pa rin titignan mo. If the baby or the fetus is positive for the IgM and then positive for the PCR, it means that the fetus have a infection of the parvovirus. Now, paano mo masasabi kung nag-recover na sila? Kapag nag-recover na sila, positive na sila for IgG. So, positive IgG in the absence of IgM indicates past infection. Okay? So, this is how you diagnose the Parvovirus B19 infection. Next is the treatment. So for the treatment, supportive treatment lang yan. Ibig sabihin noon kung ano yung symptoms, yun ang gagawin mong, yun ang bibigyan mo ng treatment, di ba? For example, kung ang plastic anemia yan, definitely blood transfusion yan. If it is the hydrops fetalis, ganun din, intrauterine blood transfusion. Ibig sabihin noon, habang nasa sinapupunan pa, pwede ka magbigay ng blood transfusion doon sa baby. Kaya tinawag siyang intrauterine blood transfusion. Okay, so that's how you manage that. Now, for the prevention, there's no vaccine against that or medicine, di ba? So you can reduce your chance of being infected with parvovirus or infecting others by being hygienic. So washing your hands, covering your mouth and nose when you cough or sneeze, not touching your eyes or nose or mouth, and avoiding close contact with people who are sick, and staying at home when you are sick. Kasi nga naman, ang transmission niyan is through respiratory droplets, di ba? Kapag mayroong umubo or suminga na may parvovirus, tapos nasinghot mo yung mga droplets na yon, pwede ka ma-infecten. Okay? So that is the Parvovirus B19 infection. Okay, so let's go to the Poxviridae. Ito yung mga malalaking viruses naman. So yung Poxviridae na yan, among the DNA viruses, they are the largest. Tandaan na, they are the largest among the DNA virus. And then they have a characteristic shape. They are known to be as brick shape in appearance. So that is their distinguishing characteristic, brick shape in appearance. So ano ba yung mga different viruses under the Poxviridae family? So you have here the smallpox, the Molluscum, contagiosum, you have the ORF, and the Monkeypox viruses. Now, how are you going to detect them? You can perform electron microscopy. Kapag ng electron microscopy, kahanapin mo yung mga brick-shape appearance like this one. Okay? Hahanapin mo. So, that is a sign na meron siyang Poxviridae infection. So, ano ba ang characteristic ng pox virus na yan? So, lahat yan, they will cause pustular skin lesions, which will develop into large scab. So, nagiging peklat daw siya that can leave permanent pock marks. So, kapag may mga lesion siya, nakakahawa siya, class. However, kapag may peklat na, and then yung peklat natanggal na, nag-dry up na, nag-iiwan siya ng mga butas-butas sa balat. Yun yung sign na nagkaroon ka ng past Poxviridae infection. Okay? And then kapag nangyari na may peklat ka na, tapos kukusa na nalaglag yung peklat, ibig sabihin noon, you are no longer infectious. So yun ang characteristic niya ng mga Poxviridae. Lahat sila ganun. Sila Smallpox, sila Molluscum, sila ORF, sila Monkeypox. Meron ka muna mga lesions dyan, mga pustules na malalaki, mga matubig, di ba? Tapos kapag ano na, natuyo na yan, may peklat na, malalaglag yan, tas yung balat mo magiging butas-butas. Ibig sabihin nun, hindi ka na infectious, non-infectious ka na. Next is so first among them is the variola virus. The variola, that is the one that can cause the smallpox. However, ngayon kasi wala na talagang smallpox sa mundo. Eradicated na siya. Why? Because of the efforts of the Edward Jenner. He is a scientist. He is the one who developed the smallpox vaccine. So maraming pinatay si smallpox noon. So, and then it caused millions of deaths before it was eradicated. Okay? It has existed at least 3,000 years. Ganong katagal si smallpox sa mundo. Pero because of Edward Jenner, nawala na si smallpox dahil sa mga bakuna. So sabi dito, according to WHO, it intensified a plan to eradicate smallpox in 1967. And then according to them, the last known case was documented in Somalia in 1977. And then in May 1980, WHO declared smallpox eradicated. Ibig sabihin noon, wala nang smallpox sa mundo. Okay? So this is all in the past. So paano ba nakakuha yung smallpox na yan? Well, transmission pa rin. Person-to-person transmission through infective droplets or through close contact na merong infection. Okay? So a patient will become infectious once they have the fever, and then they remain infectious hanggang meron sila mga pustules. Kapag meron ng peklat at nag-fall off na yung scab nila, definitely non-infectious na sila. So, ano ba ang characteristic? So, this is the characteristic of the smallpox virus. So, makikita mo, ayan, ito yung kanilang mga pustules, yan. Ito yung pustule na, nakakahawa pa. O, kita mo, bilog na bilog sila, di ba? Tapos parang may fluid, right? Pero kapag nag-dry up na, like this one, ito na yung itsura niya kapag nagda-dry na. So, gradually, the pustules dry up and dark scabs form, like this one, di ba? Scab begin to appear between 10 to 14 days after the rash first developed. And then the scab contain live smallpox virus until all scabs have fallen off and the patient may infect others. So dapat malaglag yung mga scab na yan para masabi mo na hindi na nakakahawa si pasyente. Tulad nito, meron na siyang puti. Ibig sabihin nalaglag na yung scab. Diba? Ito, nalaglag na yung scab dyan. Okay? So ganun ang characteristic ng smallpox. So meron kang dalawang virus that can cause that. The variola major and the variola minor. Okay? So pareho lang sila ng itsura. Ito lang din ang itsura ng kanilang lesions. So the fatality rate of variola major was around 30%. So mas nakakamatay daw si variola major. So you have two forms. You also have two rare forms of the smallpox. You have the hemorrhagic one and the malignant. Okay? So in the former, invariable fatal, the rash was accompanied by hemorrhage into the mucous membrane and the skin. Ibig sabihin noon, besides sa mga lesions na yan, sa mga pustules na yan, pero pa mga dugo-dugo yan, nagbibilid pa siya. Kaya nga tinawag siyang hemorrhagic eh. Yun yung nakakamatay na smallpox. The malignant smallpox naman, this was characterized by lesions that did not develop to the pustular stage but remained soft and fat. It was almost invariably fatal. So yun yung kanilang difference. Kapag may bloody, hemorrhagic type. Kapag walang blood, soft lesions lang, malignant smallpox. So, this is what it looks like. Ito yung mga itsura niya, kung paano nagde-develop yung mga pustules. So, just take a look at that. Ito, kapag wala ng mga scab, di ba, nag-fall off na, may mga puti-puti na lang. O, yan ang tawag dyan. So, hindi ka na infectious. And then, ang lesion kasi ng smallpox at chickenpox, medyo similar sila, magkakamukha sila, di ba? Kung titignan mo, mukha siyang bulutong. So, ano bang difference ng smallpox at chickenpox? So, yung mga rashes, di ba? So, yung una muna, kapag fever, smallpox, 2 to 4 days before the rash, meron kang fever. Pero kapag chickenpox yan, at the time na meron kang rashes, meron ka na ring fever. Sabay sila. Sabay ang fever at rashes kapag chickenpox. Kapag chickenpox naman, maraming, yung chickenpox rashes mo, it appears in several stages. Whereas, yung smallpox mo, rashes agad. Diba? Yun. And then, the development, mabilis kapag chickenpox, kapag smallpox, slow. And then, ito importante, yung distribution in the body. Kapag kasi smallpox, marami yan sa arms and legs. Doon siya marami sa arms and legs. Kapag naman chickenpox, marami yan sa pox on the body. So sa mga trunk area mo, sa abdomen, sa likod, doon marami ang chickenpox. Now, on the palms and soles, usually makikita mo kapag smallpox, pero kapag chickenpox, wala kang lesion sa palms and soles. So yun ang another difference with that. And then of course, death is common sa smallpox, about 10% can die, pero yung chickenpox, wala namang namamatay, di ba, sa chickenpox. So siguro kayo, nagka-chickenpox kayo noon, buhay pa naman kayo ngayon. Okay? Yun. So that is the difference. Also again, in terms of the lesion, you can see that the chickenpox scab have begun to form on day 7, like this one. Okay, sorry, the chickenpox on day 7 nag-form yung scab. While in smallpox, no scabs are observed even on day 10. So sa day 10, wala ka pang scab sa smallpox. So ito yung kanya mga difference. Now, next is the symptoms. So for the symptoms, sabi ko nga kayo na meron kang rashes with fever. Sabay sila nakikita. Okay? So, 2 to 3 days later, the virus produces a characteristic rash with bumps full of a clear liquid. Ito yung tawag natin na pustules, which will later fill with pus and finally develop a crust of dries and falls off. So kapag meron ka ng scab formation, leaving a pock mark, then the incubation period is approximately 10 to 17 days. So yung rashes, ang tawag mo doon ay macular rash. Yung mga pustules, yung mga lesions, ang doon ay pustules. Kasi may mga pus, di ba? Yun. So again, kapag yan ay smallpox, the lesions are present in greater concentration in the head and limbs. Kaya tinawag na centrifugal distribution. Okay? So for the prevention and treatment, again, you can use the vaccine, the ACAM 2000, or the LC16M8 and the MVA. Ito yung mga vaccine. For the antivirals, they have the CMX001 and the ST246. So that is the smallpox. So let's go to the cowpox. So cowpox, so from the word cow, di ba, malamang, isipin nyo cows, di ba? However, human cases has been transmitted through cats sa mga pusa daw. So nangyayari ang infection na ito sa mga farm, di ba? Kunyari, sa isang farm, meron ka mga cow doon. Tapos meron din mga animals such as dogs and cats, di ba? So from the cow, yung lesion ng cow, mahahawa yung pusa. And then, yung pusa, lalapit siya sa tao, tapos yung tao, hahawakan niya yung pusa, di ba? That's why, yung mga lesions niya ng tao, makikita mo doon sa kamay na pinanghawak sa pusa. So that's how the humans can get it. Paano daw nakukuha ng pusa? The cats can acquire the infection from rodents and then pass it on to humans. Okay? So ganun yung cycle niyan sa mga farm. Magmula sa cow, papunta sa rodent, papunta sa cat, hanggang mapunta sa humans. And then the lesions can be found in the arms or the hands of the human who touched the cat. Okay? Yan. Ito. Yung mga yan. So, anong characteristic niya? They have a one large pustular skin lesion like this one. Napakalaki ng kanyang mga lesions. One large pustular lesions is most commonly found on the face and hands, infecting the point of contact with the infected cat. So, kung ano daw yung pinanghawak mong kamay, yun, makikita ang mga lesions. So, just like other pox infection, dapat magkaroon ka ng scab formation, di ba? Meron kang crust formation dyan, like this one. And then, kapag nag-fall off na yung crust, the patients are no longer infectious. Next is the Orph and Milker's node, like this one. This is what you call the Orph and Milker's node infection, okay? So, for the Orph and Milker's node, this is also called as the sheep and goat handlers Orph infection. So, kapag daw Orph, nakukuha yan sa mga sheep and goat. Okay? Kapag naman yan ay milker's node, nakukuha sa cows. Yun ang kanyang difference ha. Kapag Orph, you can get that from the sheep and the goat. Kaya tinawag siyang sheep and goat handlers disease or the Orph disease. Okay? Now, for the cow naman, ang tawag dyan ay milker's node. So, for the Orph virus infection in animals, it is commonly referred to as sore mouth, scabby mouth, or contagious eczema. So, yung mga animals daw muna, yung mga sheep and goat, doon mo muna makikita sa kanila. Meron silang sore mouth, scabby mouth, or contagious eczema. Okay? So, kapag nahawakan yan, yung mga animals na nahawakan mo, then definitely magkakaroon ka ng infection like this one. Humans that are infected typically develop ulcerative lesions or nodules in their hands. Like this one. Yung pinanghawak mo doon sa infected na goat and sheep, magkakaroon ng mga lesions like this. So, kapag naman sa cow, sa cows or milker's node, ang tawag naman doon ay pseudo-cowpox infection. So this is being caused by the Parvovirus virus. So you're going to have a single lesion on a finger or hand or forearm, but may also appear on the face and neck. So mabalaki ang kanilang mga lesions, about 1 to 2 centimeter vesicular lesions. So ganun pa rin, meron kang mga pustules na makikita, and then the scab will form. Kapag nawala na yung scab, hindi ka na infectious. So anong difference niya sa milker's node? Ang difference niya is that the lesion is being surrounded by a red erythematous area. So namumula daw, like this one, namumula. Yan, pulang-pula yung gilid niya. Okay, that is the difference. So there is no treatment against this one, and then the infection cannot be passed on to other humans. So ang transmission niya is from cow to human only. Cow to humans. Yun lang. And then you can diagnose this by electron microscopy and also perform PCR. So ang maganda dito, kusa naman siyang gumagaling. So after 2 to 3 weeks, magiging ano na yan, magkakaroon ng scab formation, malalaglag na, hindi na infectious. Next is the buffalo pox infection. For the buffalo pox virus naman, ito yung nakikita sa mga water buffalo. So, this is a derivative of vaccinia virus that had persisted in India in water buffaloes since smallpox vaccination was discontinued. So, nag-mutate daw, pero yung mga water buffaloes, meron pa rin sila. So, this is a disease in the buffaloes, pwede rin sa cattle. This is very similar to the manifestation found in cowpox. So, buffalo pox can also be transmitted to humans and a localized pox lesion develop. So, ano itsura ng kanyang infection? Kamukha lang ng lesion ng cowpox. So, parang ganito ng itsura niya. Pero, hindi mo siya nakuha sa cow, nakuha mo siya sa water buffalo. So, ang tawag dun ay buffalo pox infection. Yun ang kanilang difference. Yung pseudo-cowpox, nakuha mo sa cow. Ito, buffalo pox, nakuha mo sa water buffalo. But the lesions are the same. Now, for the monkeypox naman, this is what it looks like. Nakita mo yung mga katawan nila, punong-puno ng mga lesions like this. So the monkeypox virus belongs to the Orthopoxvirus genus and family, Poxviridae, of course. So the reservoir of the monkeypox remains unknown. Although monkeypox na tawag sa kanya, hindi pa rin alam kung saan yung reservoir. However, the African rodent species are suspected to play a role in transmission. So yung mga Gambian rats daw, sila daw yung nagdadala nito sa mga villages in Africa. Okay, so yung Gambian rats, nanggagaling yan sa forest, kukuha ng kung ano-anong virus doon, tapos pupunta sila sa mga villages hanggang sa makawaan nila yung mga tao. So this is most commonly in West and Central Africa. And anong characteristic? They're going to have inguinal lymphadenopathy. So nagkakaroon ng mga kulanis sa mga singit yan. Okay? And then they're going to have incubation period of 7 to 17 days. Then after that, they're going to have the vesicular rashes like this one. The vesicular rash, they appear about 3 to 5 days later, becoming pustular, and then scab formation can be seen. So how can you get this one? Through respiratory route of infected fomites. Ibig sabihin nun, class, yung pinaggapangan kung saan gumapang sila Gambian rats, tapos nasinghot ng mga tao yung mga yon, then definitely makakakaroon sila ng monkeypox infection. Next is the Molluscum contagiosum. So this one, the Molluscum contagiosum na yung class, nakikita to kung meron kang HIV. This is actually seen in late stages of AIDS. So kapag malapit ka nang mamatay sa HIV, ito yung makikita mo. Now, it causes a small wart-like lesions like this one, about 2 to 6 millimeters. Ang tawag dito is the mollusca on the skin like this one. Makikita mo yan sa hands, arms, face, and neck. So, ang tawag dyan ay the raised dome shape. Like this one, no? Raised dome shape areas on the skin with a central dimple. Ito daw yung parang bilog na yan sa gitna. Ito yung tinatawag na central dimple. Like that. Yan. So, meron siyang dome shape na rashes na merong parang central dimple sa gitna. So, paano mo ito remedyohan? So, ang gagawin mo lang dyan is that pipisain mo lang yan, di ba? You're just going to squeeze that. Okay? And then kapag na-squeeze mo na yan or natanggal mo na yan, lalabas yung mga molluscum bodies like this one. So this is a benign epidermal tumor that causes only infections only in humans. Ang tawag dito ay Molluscum contagiosum virus. It is being caused by an orthopox virus. So nakikita rin siya sa children, pwede rin. and also in late stages of AIDS infection. So for the transmission, so of the Molluscum contagiosum, makukuha mo siya through person-to-person contact, physical contact, or through infected fomites. Pwede rin sa sexual contact. Kaya nga, sinano mo siya sa HIV infection. So ano ba ang treatment niyan? So no antiviral treatment. Ang gagawin mo lang ay pipisain mo lang. You're just going to squeeze those lesions, 'di ba? Yung kanina. Yan, squeeze mo yan isa-isa. Tapos para mawala yung mga molluscum bodies para lumabas. After squeezing that, it will be forced out of the central dimple in the lesion and this will result in the lesion resolving. So matutuyo na daw siya after mo siyang pisain. So pwede rin naman yung curettage or through wherein you're going to pierce the core and scrape the seizures or cheesy material. Pwede rin ang laser therapy or get a sharp object or a needle, dip in podophylline or phenol and then butasin mo daw siya tapos pisain mo pa rin. Okay, ganun siya. Pwede rin ang cryotherapy, burning, and diathermy. So for the Yatapox and Yaba monkey tumor pox infection, so this is what it looks like. Mga single lesion lang yan sa katawan. So nakikita siya sa Africa, mainly in Kenya and Democratic Republic of Congo. Natural host comes from the monkeys. Kung paano nakakuha ng tao, unknown ang transmission. It is not known how the humans can get this from the monkeys. Now, the Yatapox and Yaba monkey tumor viruses are serologically related to each other and they are distinct from other pox viruses. They are under the Yatapox virus genus. So for the Yawa monkey tumor pox viruses, it can only cause benign histiocytoma. This is what it looks like. This is the benign histiocytoma. Yan. Then the tumors, they will regress after about 5 weeks. So medyo liliit daw sila after 5 weeks. And then sometimes you can also see appearance of multiple histiocytoma in the lungs, heart, and skeletal muscles. So nakikita daw yan sa mga monkeys. In humans, not commonly observed. Okay, kaya nga unknown ang transmission sa humans. Now, for the papilloma infection naman, this is the one that causes the cancer. Pero, hindi lang naman kasi yan cervical cancer kapag papillomavirus. Pwede rin yan mag-cause ng cancer sa mga lalaki. Kasi nga, di ba, sexual contact yan, di ba? So, kailangan dalawa sila magkaroon ng infection for that. Now, for the papillomavirus, again, that is the HPV, family Papillomaviridae. Genus is Papillomavirus. Now, it can cause lesion. Ang tawag sa mga lesion dyan is papilloma or warts. Some are oncogenic that can cause cervical cancer. Sa lalaki, testicular cancer or throat cancer as well. And then, the one that can cause cancer is actually the E6 and the E7 protein. So, nagkakaroon ka ng cancer because of the envelope protein known as E6 and E7. This is the one that can actually initiate the cancer by papillomavirus. So how you're going to get this one? Of course, sexual transmission yan. Yung mga genital HPV. Kasi maraming klase ng papillomavirus infection. Meron kasi sa balat lang. Tulad yan, yung mga warts, di ba? Kapag mga warts lang, makukuha mo yan through direct contact with contaminated materials like sharing of towels, di ba? Nangihiram ka ng mga tuwalya. Yun, pwede mo makuha yan. Or you are swimming in public places, sa mga swimming pool ng public, walking barefoot, dyan, pwede mo makuha yung skin warts. Okay? Pero skin warts lang naman yon, walang problema dyan. Pero kapag sa genitals mo nakita, sa vagina and your testes, ang tawag doon ay genital warts. So magkakaroon ka ng makukuha ka through sexual contact. Kapag naman laryngeal papilloma or warts in children, this is usually through vertical transmission. Ibig sabihin noong pinanganak si baby, lumabas siya through natural birth. So lumabas siya mismo sa vagina ng mother na merong warts, 'di ba? So kapag yung mother meron siyang genital warts during the time na nanganak siya through normal delivery, makukuha rin yun ng bata. Kaya mapupunta yung warts niya sa larynx ng baby. Kaya nagkakaroon siya ng laryngeal papilloma. Okay? So that's how you're going to get it. So, ano ba yung mga different serotypes of the papillomaviruses? So, kapag 1 to 4, papilloma 1 to 4, it causes skin lesions, di ba? For HPV1, it causes plantar warts. Take note of this one, plantar warts. HPV 2 to 4, warts of the hands. HPV 6 and 11. This is the one that causes genital warts. Okay, and also respiratory papilloma in children. For 16 and 18, this is the cancerous type. This is the one that can cause cervical cancer or even cancer in males. Pwede rin. So sa lalaki, carcinoma of the prepuce in males and vaginal cancer in females. Now, for the incubation period, about 3 months, makikita mo yung mga warts na yan after sexual contact. And then, for the cancer to develop, it will take about years. So after sexual contact mo, mag-undergo pa yan ng latency period, about many years yan. And then after many years, magkakaroon ka na ng cancer. So that's how you get the cancer. Again, hindi lang yan cervical cancer, pati rin lalaki. Sa lalaki, carcinoma of the prepuce ang makikita or testicular cancer after many years as well. Now, for the infectious period, so the lesions are present are highly infectious. So once you have the lesions, kung meron ka mga genital warts, nakipag-sexual contact ka, nakakahawa ka. So that's how you can spread the infection. So this is what it looks like sa skin. Okay, ito yung tinatawag na common warts or the Virusae vulgaris caused by HPV 1, 2, and 4. This one. And then for the flat warts naman, ang tawag dyan ay Virusae planae, like this one, flat warts lang. This is being caused by HPV type 3. They are flat and smooth and generally affect children. May condition called epidermodysplasia vericiformis from 2, 3, and up to 20 and other HPV genotype, wherein you're going to have multiple flat lesions all over the body. Kapag all over the body na, ang tawag dun ay epidermodysplasia vericiformis. So, another example, itong kanyang itsura, this one, ito yung mga genital warts mo. Okay, this is the warts in your genitals, this one. So, this is being caused by type 6 and 11. Ang other name for genital warts is condylomata acuminata. Again, it is also called as condylomata acuminata. So, anong characteristic niya? This one. So, nakikita siya dito sa penis, urethra, anus, and rectum, vulva, vagina, cervix, anus, and perineum. And also in your larynx, di ba? Pwede rin makita yan. Okay? That is what it looks like. Now, for the carcinoma naman, so sabi ko nga kanina, 16 and 18 yung common na genotype that can cause that. However, yung mga higher genotype na 31, 33, 35, pwede rin mag-cause ng cervical cancer. So this is what will happen to your cervix, di ba? Magkakaroon ka ng cancer like this one. Nagiging cancerous siya like this. Okay? Yan. So about 70% of all HPV-associated cancers are due to the genotype 16 and 18. The rest are due to the other HPV genotype, the 31, 33, and 35. So for the treatment, kapag warts na yan, tatanggalin mo lang yung mga lesions. Okay? So however, sometimes the lesions can actually disappear on its own kasi self-limiting naman yan. So they can recede about 6 to 12 months. However, syempre, sometimes kapag di siya nawawala, you can go to what they call ablative treatment wherein tinatanggal talaga yung lesion. Kapag cancer naman, well, definitely, chemotherapy na magiging gamutan dyan. So for the prophylaxis is only the vaccine. Vaccination lang naman ang kailangan dyan. So sabi dito, girls from 19 to 14 years of age, recommended ang HPV vaccination. Secondary, ito yung primary prevention mo. Kapag boys din naman, as appropriate. So kailangan din sila. Now, for the secondary prevention naman, women 30 years or older, pwede pa rin bigyan ng vaccine. For the tertiary, all women, they are needed to have vaccine against the HPV. So ano ba yung mga vaccine na bibigay? You have the Gardasil and the Cervarix. For the Gardasil, this offers you protection against all of the HPV genotype, against HPV 6, 11, 16, and 18. So protected ka against the one that causes genital warts and also the one that causes the cancer. Kasi apat ang covered niya, 6, 11, 16, and 18. If it is the Cervarix, protected ka lang against the cancer-causing type, the 16 and 18. Pero magkakaroon ka pa rin ng genital warts. So again, yun ang difference nila. Kapag Gardasil, hindi ka na makakaroon ng genital warts kasi protected ka na against 6 and 11. Hindi ka na rin makakaroon ng cancer kasi protected ka against 16 and 18. However, for the Cervarix, makakaroon ka pa rin ng genital warts kasi ang protection mo lang is only against the cancerous type, against 16 and 18 only. So, paano yung schedule dyan? Again, 3 doses siya, 3 doses daw. It's spread over 6 months. It is recommended na yung mga age group natin from 9 to 26 years old, mabigyan. Pero pwede ang 9 to 14 and then 30 years old and then all women. Okay? Next is the diagnosis. For the diagnosis, so you can get the warts and then perform cytology sections. So you can stain that using pap smear, then look for the coilocytes. This is the coilocytes, this one. Yan, the coilocytes are cells with perinuclear clearing. Like this one, makita mo yung kanilang gilid, puti lang, di ba? Kasi meron siyang pabilog daw, nuclear clearing. So puti lang yung gilid niya, like this one, okay? Accompanied by increased density of the surrounding rim of cytoplasm, which are indicative of HPV infection. So this is the HPVs, the coilocytes. So again, this is the summary of the different genotype of the HPV virus, and these are the summary of their infection. So please read this from your Mayhun, the table of human papillomavirus and their clinical significance. Now, let's go to the polyomaviruses. Now, polyomaviruses, they came for the family Parvoviridae. So, meron ka lang dalawang virus dito. You have the polyomavirus hominis type 1 and the polyomavirus hominis type 2, which is also called as the BK and the GC virus. Again, si BK virus, ang tawag sa kanya ay polyomavirus hominis type 1. Si GC virus, ang tawag sa kanya ay polyomavirus hominis type 2. Okay? So, dalawa lang sila. Now, paano mo ito makukuha? Si BK virus or si type 1, you can get this during childhood. So, this has been isolated in urine from children with cystitis, and evidence of infection has been demonstrated in children with acute respiratory illness. So, again, sa bata, ang significance niya is cystitis and respiratory tract infection. Again, cystitis and respiratory tract infection. Now, for the antiviral agent, just give the children the cidofovir, and then you're going to check infection by performing PCR test. Okay, so yun lang naman kapag BK virus. This is a disease of the childhood. Again, cystitis and respiratory tract infection in children. Now, for the JC virus or polyomavirus hominis type 2, so it can cause a PML. Ang tawag dito ay progressive multifocal leukoencephalopathy, wherein nakikita ito sa mga patients with immunosuppressed condition due to T-cell dysfunction. So kung meron kang problema sa T-cells mo, example, meron kang HIV, di ba? T-cell ang problema doon eh. Pwede ka rin magkaroon ng JC virus infection. What will happen to you if you have the PML? Kakaroon ka ng progressive degenerative brain disease. So, mangyayari dyan, unti-unting masisira ang myelin sheath mo hanggang mawalan ka ng oligodendrocytes. So what will happen to you? You're going to have changes in intellect, affectation of motor function, or sensory loss. So magkakaroon ka ng paralysis. Hindi ka na makakapag-isip ng mabuti. Okay? Yun yung effect ng JC virus. And then after 1 year, you're going to die. So sino prone na magkaroon ng JC virus? Those with T-cell dysfunction. So primarily yung mga HIV patient din as well. Okay? So pwede silang mamatay because of the JC virus. So there's no treatment against the PML. Now for diagnosis of this one, you can perform PCR testing by getting the CSF or brain biopsy. So tapos na pala. So that is the lesson for this week. That is the DNA virus part 1. So next week will be the DNA virus part 2.